Hi and welcome. This is Laikipia Health Service Doctor's Corner channel. We bring to you another edition that is helpful to educate you on matters health. And today we want to focus on matters mental health. We've had a season and a period where suicides have been on the rise, murder has been the order of the day. So today we want to examine just a little to understand what mental health is. And this production, we are going to do it in a series and a sequence. So this is just but part one of the starting on our mental health edition. On set, I have with me a specialist from Laikipia Health Service, Nanyuki, Dr. Ruth Gachuru. She's going to introduce herself to us, tell us who she is and what she does. Welcome on board. So, hi, Daktari, how are you?
Hi Eva, how are you this afternoon?
I'm fine, thank you.
Yeah, I'm fine, thank you too, and thank you for having me in the program.
Kindly introduce yourself to us.
My name is Dr. Ruth Gachuru. I am a specialist psychiatrist or a consultant psychiatrist, and I am working for the Laikipia Health Service in Nanyuki.
So today we want to tackle an issue that has been happening. Like, basically tell us, what is mental health?
Mental health is a state whereby one is able to relate with others well, is able to work well, function well in the society, function well at workplace, function well in a marriage, function well in school if you are a child, and you are able to cope with the day-to-day stresses without you breaking down.
So generally it's how well one is able to carry themselves.
Oh yes, it is actually how well one is able to carry themselves, especially in the face of challenges or in the face of trouble.
Okay. So
Yes.
when we talk matters mental health, especially in the time that we are living, the globe is facing a pandemic.
Yes.
We have seen a rise in issues that we think are mental. So can you highlight to us, what do we speak of when we speak mental health?
When we speak of mental health, like I have elaborated, I wish first to talk about what is mental illness, because that is what is more relevant to us for now. Mental illnesses are a set of illnesses that cause problems in a way a person thinks, in a way a person acts, and in the way a person feels. So these are the three main areas that are affected: feelings, behavior, and thinking. So you find that in mental illnesses, either one of these or two of these or three of them, all of them are affected. And so that is where we come out with the mental illnesses or mental diagnosis or mental disorders, which we have about 200 of them, which are recognized in the whole world. Yes.
So how does these mental illnesses present, and which are the most common ones?
Mental illnesses present with so many symptoms and signs. I'll give you a list of them, at least the most common symptoms and signs, which one should look out for in yourself, in your friends, in your children, in your spouse, if you're married, amongst your friends, if you are an employer, look out for them in your employees, your friends, and so forth and so forth. So first of all, let me tell you some of the most common illnesses, mental illnesses that are faced, not just in Kenya, but all over the world. The most common is anxiety disorder. It is a set of illnesses called anxiety disorders. And this is not just one. There are about 10 or so anxiety disorders. I think we are going to elaborate further in another forum. So anxiety disorders are the commonest mental disorders in the world. The second one is a disorder called depression or major depressive disorder. I wish to state here that depression is not stress, and stress is not depression. Depression is more than just stress. It is actually a medical condition that requires treatment. Stress may not require treatment. It just may require counseling, and it's gone.
So is stress a mental illness?
Stress is not a mental illness.
Okay.
Yes. And a mental illness is not stress.
Okay.
Mental illness is an illness that requires actually medical treatment. So going forward, I talked about anxiety disorders. I talked about depression. The other common one is a disorder called schizophrenia. The one that commonly people refer to as madness. Madness, I would put it in quotes, whereby people present with abnormal behavior, shouting, removing clothes, burning houses, burning clothes, and such like violence and such like behaviors. That is a set of illnesses called psychotic illnesses, and most commonly we have schizophrenia. The other one that we commonly see is bipolar disorder. Bipolar disorder or a bipolar mood disorder is a common mood disorder that presents with mood changes. Sometimes your mood goes so low, you feel like you are weak, you feel like crying, you feel like you don't want to see anyone, you want to isolate yourself, you don't want to go for family gatherings, you just want to work on yourself. And before, you are not like that. There are people who are quiet or reserved by nature or by personality. But when you see a change of behavior for somebody who was initially active and talkative, but has now changed and has become so quiet, so reserved, isolated from other people, there is a problem there. And most likely, there is a depression. Sometimes the mood goes on the other side, the opposite, high. These people, you find they are talking too much abnormally, they are laughing too much abnormally, they are talking of big things, they are saying they are billionaires, some of them are saying they are prophets, they are even calling themselves God, such kind of things. And they are even calling themselves the president, or they want to relate with people of higher status. They can even tell you, I am afraid of the president, I am afraid of the governor, and that is not true. But they believe that in their minds, and they are not pretending. For one thing, mental illness is not pretense. Mental illness is not misbehavior. Mental illness, I would say at this point, is not witchcraft, it is not demon possession. Mental illness is a recognizable set of illnesses that composes changes in our brain systems. Our brain chemicals, and even the structure of the brain. So there are some chemicals that in the brain that either go low, we call them neurotransmitters, including serotonin and dopamine and such. They either go down or go up. So when they go down, we may get things like depression. When they go up, we may get things like schizophrenia. So when I say medical, there are medical illnesses requiring medical treatment. Yes, medical treatments work. And mental illnesses, I say, and I insist that these are problems that are treatable. There are illnesses that have treatments, so many treatments, and they are actually treatable or manageable. You find that when we treat these mental illnesses, the chemicals become imbalanced. Balanced. Like the way we have diabetes. Diabetes mellitus is where the blood sugar goes up.
Yes.
The same way, the chemicals in the brain also become imbalanced.
Okay.
So these treatments, they come to balance the chemicals.
Okay.
And you find that when we treat these mental illnesses, people actually recover. There are people who recover completely, like depression, you can recover completely. But there's some illnesses that, yes, we will manage you, we will not have the symptoms, but you may need to continue with treatment for many years or even for life, like schizophrenia. So those are some of the common illnesses that we have.
No, Daktari.
Yes, we will.
Tell us, you've worked in Laikipia Health Service Nanyuki for a while.
Yes.
What are the most common cases or issues you handle here?
The most common cases that we handle here are depression, anxiety disorders, bipolar disorders, schizophrenia, and substance abuse. Those are the 5 main cases that we handle here.
So among the people that come to see you, are they consistent? Somebody comes 2-3 times, then they drop.
What you normally do, mental illness has to be followed up. And you have to follow up treatment. So we do what we call the treatment for initiating a cure or recovery. And then we do what we call follow-up or maintenance treatment. You find that when somebody comes and we treat for schizophrenia, they do well, we do follow-up. Maybe after a month, after 2 months, those people have to be followed up for life. There are those people we have treated for depression and they have improved. Those people, after 1 year, 2 years, we can stop follow-up. And then maybe if they get another episode of depression, they can come and we treat again. And maybe I will not, let me mention here, substance abuse.
Oh, it's also a mental illness.
It is substance abuse is also a mental illness, including alcohol use disorder, cannabis use disorder, and the like. Yes.
So you've spoken about a disease like diabetes. Diabetes and hypertension, these are diseases that come with age. Is mental illness the same, or it can happen at any time?
Yes, thank you. Mental illness can happen at any age, any social status, any race, any tribe. So mental illnesses, children can get mental illnesses. You have heard of mental illnesses like autistic disorder or autism. You have heard of mental illnesses like ADHD. These happen to children. Other adults get, in adolescents, they can get depression, bipolar disorder, they can get schizophrenia. For the older people, they commonly get geriatric illnesses like dementia, which is also a mental illness. So it cuts across all ages. Yes.
Now, the other issue I want us to address is suicide. Is it a mental illness or is it a symptom?
Thank you for that question. Suicide is good that you have brought that point out because it is commonly happening these days, especially in this age or era, commonly known Corona era. So suicide is there and it's real and it's happening. It has been there from the beginning. It's not a new thing. But we find that because of the way our society is going, there are so many pressures in this life. And of course now the most current pressure is the coronavirus pressure. So you find that many people are committing suicide, or let me say they are killing themselves.
Yes.
Yeah, that's a better term to use it. Suicide or killing oneself is caused mostly by a mental disorder. 9 out of 10 people who have killed themselves, they have suffered a mental disorder. Either it has been recognized or not. There are those people who have been on treatment, yes, but for some reason maybe they took treatment and they stopped. And they complicated to suicide. There are people who never even realized that they had mental illness. So they struggled, they became desperate, they killed themselves. But if you realize, if these people had sought good treatment or mental health care, they would have been saved. So 90% of people who commit, around 90% of people who kill themselves, they have mental illnesses. Yes. So early recognition of symptoms and signs of mental illnesses in the society can help so much reduce the incidences or cases of suicide. If those people are treated early and they are treated adequately. Yes.
So as we wind up, you've spoken of one consequence of failing to seek mental illness treatment.
Yes.
What are the other consequences?
There are other consequences that come when one refuses or somehow does not know that they have mental illness. In fact, most people don't know that they have mental illnesses. Most people find that they are lacking sleep at night, they are lacking appetite, they are lacking energy. You find that somebody feels like they cannot even be able to perform their duties well. A businessman cannot be able to arise early and go to business, they can't perform. People are isolating themselves for no reason. You find that somebody has just changed behavior. Either you are a child or somebody you know, or even yourself. A child has just dropped school performance for no reason. When you see a sudden change of behavior, or even a gradual one, most likely this person has mental illness. So if you do not treat this mental illness early enough or adequately, one of the complications is suicide, and that it is the worst. The other complication is homicide. Most of this homicide is killing other people. Yeah? Many mental illnesses, like especially the psychotic illnesses, they result in violence. Yes. So violence is one of the consequences of some of the mental illnesses we have. So, and violence may lead to homicide, whereby people fight and you find that they kill themselves. Many people who are in jail, some of them, they had mental illnesses which were not recognized. And they went, fought, had violence, and they ended up killing their loved ones or other people. So the other one is loss of marriages, separations and divorces. Many of the separations we have these days and divorces are a result of untreated mental illness. You find that people start quarreling in a marriage, husband and wife, they start quarreling, they become angry, either the wife or the husband. They become angry, they start doing their own things, they are not being understood, they change from their normal behavior. So you find that they don't understand that what is happening is a mental illness. Yeah. So the spouse thinks this lady has changed, maybe something has happened, somebody has maybe lied to them that they should, misbehave. Yet it is an unrecognized mental illness. So separation and divorce is one of the unfortunate consequences of untreated mental illness. The other one is school dropouts or decreased or poor performance in school. Somebody who was performing very well stops performing and even drops out of college or high school. If they get treated well, these people will recover and go back and finish college and finish high school. Unfortunately, there are people who got sick in their 20s when they were in high school. No one recognized that they had mental illness. So these people just dropped off like that. And even up to today, many people have never been treated for mental illness. Yet they dropped from school long time ago because no one ever recognized that the issue was an underlying mental illness. So school dropouts and low performances are one of the complications or the consequence of not treating mental illness. The other one, of course, is job losses or business failures and business losses. Yeah, so because you find that most people who have mental illnesses are not able to perform. Yes, they are not able to make decisions, they are not able to concentrate, they are not energetic. People are isolating themselves. I mean, people are even shunning away from them themselves. They are also isolating themselves. So they are not able to function well in society. So if you find somebody is not functioning well in school, functioning well in their business, in their work, find out, among other things, of course there could be other illnesses like diabetes, hypertension, or the like. Find out what is happening. If you rule out all these other illnesses, because lack of energy can come from diabetes mellitus, or even hypertension. But if you rule out all medical illnesses, that person should be screened for mental illness. Yes, and if they are treated, that person will get well, and they will continue with life.
So that is it from our today's edition of Laikipia Health Service, Doctor's Corner. Matters mental health, and I won't dwell on that much. Just as we've been told, don't stigmatize yourself. We are living in tough economic times, tough social times, like everybody is battling something. But if you're there and you feel that you have the symptoms that our specialist has talked about, reach out at Laikipia Health Service Mental Department. We are here to serve you. We are here to help you walk the journey of mental recovery, because as you have heard, it's treatable and it's curable. We meet on the next edition. Remember, this is Laikipia Health Service Doctor's Corner. Thank you.